Hospital cases for traditional medical problems like heart attacks are down significantly across the Philadelphia region. And doctors are worried that fear of COVID-19 is stopping patients from getting treatment that they need. Health reporter Stephanie Stahl has a new warning from doctors. Stephanie?
Well, Jessica, the drop in emergency cases is partially because people are home, not going out as much, so there are fewer accidents. But doctors say a byproduct of COVID-19 fear is other patients not getting treatment for serious conditions, and they could end up even sicker. Fear of COVID-19 is scaring away traditional patients. Doctors say many people with things like heart attacks, strokes, and infections are not seeking care in hospitals.
We're seeing a reduction overall.
Dr. William Gray with Mainline Health says while hospitals are busy with COVID-19 patients, admissions for other conditions are down. People are fearful of being exposed to the virus in the hospital.
It's important to understand that just because there's a pandemic doesn't mean that the regular health care that we deliver stops.
Ambulance calls are also down, people either going to urgent care or toughing it out at home. But delays in treatment, especially for a heart attack or stroke, can be dangerous, even deadly.
I've seen patients already who have survived heart attacks but have had complications because of it. And they had the heart attacks at home, and had they come in, they would not have had those complications.
Cardiologists have seen a sudden drop in heart attack patients in recent weeks, which has prompted the Heart Association to warn people not to wait for treatment.
There are a myriad of other things like infections, pneumonias, for instance, that don't have anything to do with COVID, but can still be very much life-threatening. These things need to be attended to. And I think the major message is that patients should not be afraid of coming to the hospital.
To protect patients, hospitals have created separate areas for COVID-19 cases and have extensive measures to keep the virus from spreading.
The chance of getting COVID in the hospital are very low.
Now, doctors say people with pre-existing conditions like heart disease, diabetes, and cancer need to get care if they develop unusual symptoms. And remember, many doctors and hospitals have telehealth visits so patients can check in from home. Jessica?
Stephanie, thank you.